Assalamu alaikum. Ultrascan Diagnostics. Here, this is the CBCT of the patient that you had requested. The area of interest is the lower right 8 and its association with the inferior alveolar nerve. Now, on the panoramic view, you can see that this is a mesio angular impaction, and you can also characterize it as horizontal, but we will characterize it as the mesio-angular impaction. And the inferior alveolar nerve is relatively close by. When we look at it from an axial point of view, which is a top to bottom point of view, we will show you here, slightly zoom it in. This is the axial, this is the right side. And here you can see this is the wisdom tooth here. The wisdom tooth is placed lingually, inferior alveolar nerve is buccally. As you're moving more inferiorly, you will see that the roots of the inferior alveolar nerve are approximately 6 millimeters away from the inferior alveolar nerve. Now, when we look at it from a transaxial view is basically the proximal view. This is the 7, and here you can see this is the 7 with extremely long roots. And now this is the 8 moving distally. You can see that this is the lower right 8. This is the ground portion. The mandible is quite thin in this region, and as we are moving more distally, you can see that the tooth is quite significantly away from the inferior alveolar nerve, and this is the apex of the tooth, and from this point of view it is again approximately 4 millimeters away from the inferior alveolar nerve. Now we're going to take you through a slightly different view. This is the sagittal view. Sagittal view is basically the side to side view. You can also see or appreciate that the root apex is quite significantly dilacerated and curved at the so apical 1/3 of the root is quite significantly curved and dilacerated, and this is going to be something that is of note when the extraction is being done. This is the inferior alveolar nerve, and the apex is relatively far away from the inferior alveolar nerve. Something to note as well is that the lower right 7 is also getting carious at the cemento-enamel junction due to the emerging lower right 8. So if there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.